At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Causes and Treatment for Low Back and Leg Pain on Wednesday, February 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The following program is paid for by its sponsors, who are solely responsible for its content. Views expressed are not necessarily the views of WMAL.
Dr. Tom Roselle live right now on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom Roselle. We got a great program for you today, again, right on 105.9 FM, WMAL, here in the Washington metropolitan area. We've got a lot of things to talk to you about, but mostly your pain. I know sometimes I can be a pain to a lot of people, but we're going to talk about your pain going down your leg. What do we call that? We call it sciatica. But a lot of you don't understand it, where it's coming from, what the problems are, and more importantly, does your doctor. And by the time we're done today, you're going to know more about sciatic pain than your doctor does. And that's the important piece, that you can ask the right questions and get yourself fixed. So listen, this is all leading up to a program on February the 18th at the Roselle Center in Fairfax, Virginia. Dr. Harlan Browning, who we lovingly call the professor, will be co-hosting. And those of you who have heard him before know this guy's a wealth of knowledge, but we're going to be showing you differentiations of low back pain and leg pain and sciaticas and femoral pain and neuropathies and so forth, what that really means. And I'm going to kind of, always like putting my 2 cents in, but we'll get it done for you. So here's the deal. Let's kind of pick it apart a little bit, but I want to be kind enough to answer a question that one of our listeners had reached out to. They asked me, said, Dr. Tom, what do you recommend to get us through the winter months? You don't get sick. Why is that? Well, I cheat. I cheat. That means that I take things on a regular basis every day that upregulates my immune system and keeps me a little bit more protected than most everybody out there. And I do get some exercise and I eat well and I don't eat a lot of sugars, almost none. And so a lot of you say, yeah, I can't do any of that so far. Well, here's the deal. If you go to drtomroselle.com or rosellecare.com and go to our Ageless Health store, you're going to see me running my mouth there and talking about 4 very specific supplements that I recommend to my staff. We have them out for them to take every day. My family takes them every day. I take them every day. And that helps bring up immunological response. So go to drtomroselle.com. You can order it right there online and check it out. This is not telling you it's curing anything, but I can promise you it will tweak your immune system in the right direction. So the slings and arrows of the nastiness that's out there is something that you may not have to deal with. So go to agelesshealthstore.com or drtomroselle.com or rosellecare.com. And by the way, that's how you register for this class on February the 18th as well. Let's get into the program. Sciatic pain, that's leg pain. It's ugly. It burns. It's numb. It throbs, but it's only in a very specific area. If you have pain in front of your leg, down your thigh, into your shin, that is not sciatic pain. That is femoral pain. It's from a different group of nerves. Sciatic pain, sciatica, is pain that goes down from your butt down to the back of your leg, to the outside of your lower leg, into your foot. That is a true sciatic pain. And it's the sciatic nerve, my friends, is not just one nerve. It's 5 nerves. And they come together about the size of your finger, comes out through your butt on the side, your buttocks area, through an area called the sciatic notch in your pelvic area. And depends on which branch, which fiber is being irritated, determines where the pain is going from. So it's not front leg pain. It's not inside the leg pain. It's back down from your buttocks all the way down the back of your leg, into your calf, into your foot, into the outside. And depending on where it is, determines the branch that is bothering you. So understand that not all leg pain is sciatic pain. Now, I'm going to use terms that many of you have heard because you've suffered from leg pain, right? So your doctor's going to tell you that you have a slip disc. Your doctor's going to tell you that you have spinal stenosis. Your doctor's going to tell you that you have a piriformis syndrome. Your doctor's going to tell you, I don't know, it shouldn't be there. But how do they diagnose it? And that's the key. If you diagnose something, you find the why is that. And if you can find the cause, the why is that, then you can begin to reverse and change things. Otherwise, you're treating symptoms. If you go to somebody who doesn't ask you the questions, when did it first start? When did it first happen? How does it get worse? What does it get better? And so forth. And they don't really dig into the triggering mechanisms. When was the very first time you ever felt anything like this? And then look at several months before that and lifestyle surrounding it and so forth. They're not asking you the questions that will determine what the problem is. So here's the deal. We're going to break that down a little bit. On the 18th of February, we're going to get into it really deep because we're going to talk about that back pain. We're going to talk about the femoral pain. We're going to talk about sciatic pain. We're going to talk about neuropathies and so forth. So join us. I promise you, you're going to learn a lot that night. And here's the key deal. My book, Ageless Health, Health is a Do-It-Yourself program, that was written so you can be your own diagnostician, at least holding your healthcare providers to the task of doing it the right way. So here's the deal. You're going with leg pain, right? Okay. So does your doctor tell you, I want you to bend from your waist, go as far as you can, stop when it hurts you? So if they do that, they've started at least 5% of the diagnostic mode, right? Now, the next piece of that 5%, taking it up to about 7-8%, they should get behind you and they should hold your hips together. And then they tell you to bend again. If holding your hips together makes it worse, makes the pain in your leg worse, makes the ache in your low back worse, it's telling you that it's coming from your spine because now you're locking the pelvic structure so it can't move, so there's no motion. It's like putting a brace on it. However, if it makes it better, it tells you it's coming from probably the sacroiliac area. Now, next step is this. Do they have you walk on your toes? If you can't walk on your toes, it's the last disc space in your low back that may be involved. Do they have you walk on your heels? If you can't walk on your heels, it's the one above that may be involved. There's a lot of different pieces of the puzzle. Lie on your back. They grab your leg and bring it up just a little bit. If the pain shoots down your leg, that tells you it's coming from the upper part of your body, perhaps spinal stenosis or a slip disc. Now, you can do that yourself. Have your partner, your husband, your wife, or your significant other, when you're lying flat on the bed, take your leg very gently, keep it straight, and slowly raise it up an inch, 2 inches, 3 inches, 4 inches, 6 inches, 7 inches. When you get to that place of pain, stop. That tells you that you're tractioning on the nerve root someplace along the line that's causing the problem. Take the foot at that point. Don't drop the leg, just hold it and take the foot and push it towards your head. If it makes it worse, that confirms that you either have spinal stenosis or there's a disc that's bulging in position. So you begin to differentiate the different functional capacities that should be normal. And if they're not normal, then it tells you that you've got a problematic situation. So you have to dissect it. You have to bring it down. So here's the deal. If you walk in to the doc and say, Doc, my leg is killing me, and they have to ask you, when does it hurt the most? And it may be hurt the most when you sit down. And is it immediately when you sit down or when you are sitting there a long period of time? Here's a differentiating factor. If you sit down and it feels comfortable initially because you've been on your feet for a while, but then it starts building, it gets worse, and you get up and it's difficult to get up, but once you start walking, it's better. It tells you that your sacroiliac joint is not holding in position. And then there's a lot of muscles that are associated with that. But it has to fit that criteria. Then you would do the other things I told you about. Bend forward, brace the pelvis, walk on your toes, walk on your heels. And that will tell you really what's going on. Don't let anybody say, take these and let's see what happens. That's not the way it works. You know, you take an anti-inflammatory, you take a muscle relaxant, will it give you a little bit of resolution? Perhaps. But does it answer the question, where's it coming from? No, it does not. Now, those of you who had a sciatic pain that radiates down the leg, a lot of your doctors say, well, you have a piriformis syndrome. Well, a piriformis syndrome is a muscle, it's a long triangular shaped muscle that comes from the lower part of your sacrum, that wedge shaped bone at the bottom of your spine, and goes out and attaches to your hip. If that muscle is inhibited, weak, it can cause that problem to show up. It can also, if it's too tight, which is only about 20% of the time, cause the same type of thing. So you have to be able to distinguish between a muscle that is too tight, spasm, or a muscle that is too weak, kind of floppy around. And by the way, 80% of the muscles that are involved in a pain pattern problem or a disrelationship with the joint space is really the weak muscle, not the muscle that seems to be too taut. The muscle that's too taut, because it's not being balanced properly by the other side, will feel sore if you touch it. But that's not the problem. You got to fix the other side to make it go away, right? All right, so let's get into this a little bit more. It's really important that you understand what the issues are when it comes to this nagging, terrible, radiating, burning numbness that you get down in your legs and then in your toes and so forth. If your big toe is a problem child, it may be gout, but it also could be weakness of the nerve of one of the branches of the sciatic complex, remember 5 nerves, and it's coming from your low back. So if that big toe hurts, also you can also guarantee that the arch on that side will be not cooperative. It'll be flattened more so than the opposite side. So if that's the case, that's another indicator that there's a problem. Say, hey doc, my toe hurts, and is it swollen? It's probably not gout. Is it red? Probably not gout. Is it thickened? Probably not gout. But if it's sore, is it painful, it's even difficult to touch it with no of those other characteristics, it's coming from a neurological compression someplace along the line. And that sciatic nerve, by the way, can be irritated from the source, one of the 5 nerves of the low back, or any of the joint spaces that it goes through. One could be just below the knee, on the outside. Another one could be your foot bones. Often, this relationship between something called your talus, which is the biggest bone of your foot, the cuboid bone, or the calcaneal bone. There's 3 of them. Those are the largest ones of the foot. Now, if any of those bones are off, it can cause that sciatic nerve to be entrapped, and now you can have retrograde pain. That means it goes up backwards, and it can affect the leg all the way up, and that's where your calf hurts all by itself. At that point, it's usually not coming from the low back. It can be if the muscles aren't working the way they're supposed to, but it's often coming from that. So you got to check all the areas. You got to check the muscles of the foot. You've got to check the muscles of the leg. You have to check the muscles of the low back. And said, well, my doctor pushes down on my leg. Well, let's take the upper part of the leg from the hip down to the knee, right? So if we just did the front, which is really not going to be affected by the sciatic plexus, you have your thigh muscle, quadricep, which is 4 muscles. You have a sartorius, which is another one. You have a small one coming from your pubic bone going into your leg. It's called the pectineus. Then you have 3 other muscles called the adductors. I know I'm confusing everything right now. But if you go to the backside, you have the hamstring muscles. There's not just one. There's 4 of them that are sitting there. You have the gluteus muscles, gluteus max, minimus, medius, piriformis, gemelli. Am I making you crazy right now? Well, I don't mean to be doing that. I'm just trying to tell you that it's more complex than just finger waggling and saying this must be what it is. You have to be very specific relative to that. So, if you're sitting there, you've been to the doc, they've got you on all kinds of medications, you can't play with your kids anymore, your grandchildren, you can't do the things, you forget about playing tennis or going for a walk or going skiing and so forth, your leg starts throbbing. What's causing it? It's not okay to cut, to drug, and to debilitate. You have to find out why it's there to begin with and then begin to resolve that. How many of you have gone to a doc and say, well, we'll put you on an anti-inflammatory and we'll see if it works. And as long as you're taking the anti-inflammatory, the pain is modified, but the strength of the leg, your capacity to do anything hasn't shifted, hasn't changed. Why is that? Listen, if you go downstairs and it's difficult for you to walk down the stairs, it's usually your hamstring and the posterior muscles that are involved. That would be an indicator that perhaps the sciatic nerve is involved. Patients will say, I can walk upstairs without any problem. I can't go downstairs, doc. Well, that tells me that we have an issue with the hamstrings and the muscles that respond to it, but the nerve roots that go there, and the nerve roots that go there are part of the sciatic plexus. Remember I said plexus? 5 nerves, not just one. Sciatic, you can look it up, go on, sciatic, nerve, and then look at all the places it comes from. There's 5 different sources of that thing. And if you know that, it's not okay just to say it's one and done. You have to understand it. So when you go to your doc, here's what I want you to do. You have to make sure that they're asking you the right questions and say, this has been here. I have this pain, but I've had it for years. And some guys are pretty sharp guys, and they're going to ask you the right questions. When was the very first time that leg started kicking in? When, did it take place relative to injury and falls or slips or positioning, or what happened? Dig deep. And what makes it worse? What position do you get into that relieves it? Is there anything that you can do that makes it a whole lot better? What have you noticed that has taken place since then? Guys, here's the deal, and I'm going to be pretty straight up with you. If you have leg pain, if it's persistent and it goes on long enough, I can promise you're going to ultimately end up with a mechanical ED problem. You heard me. You're going to end up with a mechanical ED problem because the nerve in your low back at the last disc space is the S1 nerve root, and it goes right to the scrotum. It goes to your friend. And if that low back is compressed, that sciatic branch is compressed, that's part of the distribution. So you can have leg pain and numbness, but all of a sudden, you're going to start seeing other things not working. So is it something you should ignore? Just take the medication to make the numbness or the pain go away? Or maybe you better get it fixed and find out why it's there before it causes other problems in your life that you don't want to deal with. I don't know about you, but kind of important, right? Ladies, same thing, by the way. If you have a sciatic low back pain and it's coming from that area, the tissue of the vaginal canal is going to be irritated. It's going to hurt. And you're going to complain of that type of situation. Dyspareunia is the technical term for it. But there's always a reason, except we ignore them. Now, I'll give you another. We talked about it, I think about a week ago, about hidden causes of sciatica. And one of them is when the perineum, the lower portion of the muscles that hold everything inside, rectal sphincter, scrotal system, vaginal canal, and so forth, if that is weakened and it's tenting downwards instead of slightly upwards like a saucer, inverted saucer, that can cause all the things that we're talking about as well. Look, you have to make sure that you find the cause of anything. And on the 18th, February 18th, right here at the Roselle Center for Healing in Fairfax, the professor, Dr. Harlan Browning, and I are going to go through this very specifically, very much in detail. And we're going to show you things that you can do to help yourself. Things, we're going to point out what happens if you ignore it over a period of time. What happens if you continue to take medications that have other impacts on other areas? Unfortunately, we're in a society today. This is me dealing with thousands and thousands of patients, that we forget to ask the why, that we start just treating the symptom process. Doc's got 5 minutes to see you. One and done. Here, take this. Let's see what happens. If they can't figure out, you go someplace else. If you go to emergency care someplace, right? Doc in the box on the corner. They might take an x-ray and because they got to do something to generate income. And they say, you need to go to the ER. Well, why can't you fix it? Why can't you do something about it? if you don't understand the process, meaning the mechanics that are involved, the electrical system called your nervous system, you can't figure out why that leg pain's there. Remember, sciatica is back pain, meaning back of the leg pain. And it come from your back. You can have back pain as well. But I gave you a couple things to think about already. What's that? If the pain is in the front of the leg, it's not sciatica. Don't let anybody tell you that it is. If the pain is one that only shows up at a certain time, meaning that I only feel it in the middle of the night and my leg aches a little bit, maybe not sciatica. Sciatica is 5 nerves. It's a mechanical disrelationship. There are multiple triggering mechanisms that cause it, but you have to understand it to get rid of it. Could it be significant slip disc? Absolutely 100%. Does a slip disc have to be treated with surgery? No. Does it have to be treated with injections? No. You have to determine the relationship of the bony segments of your spine and your pelvis and the muscles that hold them together and see what can be done to resolve normalcy and get it back in. It's like your teeth. If your teeth are out of position, if they're not hitting the way they're supposed to hit, then you have to find out why. Is it your temporomandibular joint? Was it bad bracing that took place? Is it a missing tooth? Is it a crown that was put in too high? And all the secondary ramifications that come from that. The same thing is with the low back. You know what? It could be your shoes. You know, I kid women all the time. I said, more and more of you are getting out of one of the most destructive pieces of clothing that was ever designed. And I think there's a lot of guys that hated women, and that's why they did it. And they look at me, what are you talking about? I said, your stiletto heels, the 3 and 4 inch spikes that you wear all the time. It shoves your pelvis forward, and your back has to arch back to balance, and you pinch the nerves that go down to your leg. And they affect what? They affect the uterus. They affect the legs. They affect everything that, you have to deal with in a pain pattern. Not okay. And they look at me like, what? What do you mean? My shoes? Yeah, your shoes, unfortunately. And now I become their worst friend. If you understand why something is happening, you can resolve it, you can turn it around. If you don't take the time to understand when it happens, what the condition is that it's manifesting, you can't fix anything. It's not fair to you. So what I want you to do is know more than what your doctors know. I want you to ask the right questions of yourself, but also of your doc. It's important that you do that. So when you have leg pain and you're going down the stairs and it's difficult for you to go down the stairs and it makes the pain worse, it's probably the sciatic branch. If you go upstairs easily, it has nothing to do with sciatica. But if you go upstairs and it's difficult, it's not the sciatica. So the sciatic nerve runs down the leg, into the calf, down the foot, side of the leg, but it doesn't run in front of the leg and it doesn't run inside the leg. It doesn't produce weakness there. That's a different nerve root. It can be multidimensional. It can be spinal stenosis. It can be a slip disc. It can be a piriformis problem. It can be a distortion of the pelvis. It could be a sacroiliac condition. Which one is it? Your doctor, your healthcare provider has to take the time to ask you the right questions, but also do the examinations that are necessary to show which one is which. Listen, I've given you a lot of data. We're coming up in less than a minute to the end of the program. But here's the deal. February 18th, join me and the professor, Dr. Harlan Browning, and we're going to talk about your back, your low back pain that never goes away, and your leg pain, whether it's sciatica or femoral pain and so forth. But we're going to give you some answers. We're going to show you how to determine it yourself. We're going to show you what you can do about it, how to make a difference in it, because that's why we're here. That's why I wrote the book, Ageless Health. Health is a do-it-yourself program. We're coming up to the end of the program. I love doing this for you. I could talk to you all day long, but I do it for one reason. Besides knowing you got to have the data, but simply this, I love you all. You have a great Sunday. Take good care of yourself. I'll see you on the 18th.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Causes and Treatment for Low Back and Leg Pain on Wednesday, February 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
There's two kinds of love in this world. There's the kind you want and the kind you need. But everybody has the capacity to be kinder to one another. You should feel like heaven to make another's day. You should feel like heaven to live a better way. It feels like heaven to be alive, to be alive. It feels like heaven tonight. There's always a certain danger in learning to love a stranger. But faith teaches every man to strive for the best you can. You should feel like heaven to make another's day. You should feel like heaven to live a better way. It feels like heaven to be alive, to be alive. It feels like heaven tonight. If you don't know anymore to believe, and you can't count anymore all the times you've been deceived, if you're searching for something to call your own, but nothing comes to mind, and no place feels like home, you've got to see it for yourself. Take some time to understand. You're only gonna make it if you take another's hand. If you see a child smile or read a letter that sheds a tear, that's what you remember, and that's why you are here, 'cause you are loved. You should feel like heaven to make another's day. You should feel like heaven to live a better way. It feels like heaven to be alive, to be alive.